Medical coding is the intricate process of translating medical procedures and diagnoses into universal codes. These codes are essential for the seamless operation of the healthcare system. Imagine a doctor treating a patient for a broken leg. The treatment involves multiple steps from initial examination to follow-up care. The doctor's notes, full of medical jargon and detailed observations, need to be recorded and billed accurately. This ensures that the patient receives the correct treatment and the healthcare provider is compensated fairly. This is where medical coding comes in. Coders meticulously review the doctor's notes and translate them into standardized codes. Trained coders use codebooks like ICD-10 and CPT to assign specific codes to the fracture, treatment, and any other services provided. These books are comprehensive guides that ensure accuracy and consistency. These codes are not just random numbers, they are carefully structured to represent specific medical conditions and procedures. They represent a standardized language understood across the healthcare system. This common language ensures that everyone, from doctors to insurance companies, can communicate effectively. From hospitals and clinics to insurance companies and government agencies, these codes facilitate communication and ensure everyone is on the same page. This uniformity is crucial for the smooth operation of the entire healthcare system. This standardized system is crucial for tracking healthcare data, processing insurance claims, and even conducting medical research. It allows for the collection of valuable data that can be used to improve patient care and healthcare policies. Medical coding is the backbone of the American healthcare system. It involves the transformation of healthcare diagnoses, procedures, medical services, and equipment into universal medical alphanumeric codes. These codes are critical for the documentation and tracking of patient care. It's the invisible force that keeps things running smoothly. Every time a patient visits a healthcare provider, their visit is documented and coded. This ensures that the healthcare provider can be reimbursed for their services and that the patient's medical history is accurately recorded. Without it, hospitals wouldn't be able to bill for their services, insurance companies wouldn't be able to process claims, and patients would face a logistical nightmare. The entire healthcare system relies on accurate and efficient medical coding to function properly. Accurate medical coding ensures that healthcare providers are reimbursed for their services. This not only affects the financial health of the providers, but also impacts the quality of care that patients receive. This revenue is essential for hospitals and clinics to keep their doors open, invest in new technologies, and continue providing quality care. Without proper funding, healthcare facilities would struggle to maintain their operations and improve their services. Moreover, medical coding plays a vital role in public health initiatives. It allows for the collection and analysis of data on a large scale, which is crucial for understanding and addressing public health issues. By tracking patterns in diseases and treatments, researchers can identify trends, allocate resources effectively, and develop strategies for disease prevention and control. This data-driven approach is essential for making informed decisions that benefit the entire population. The data derived from medical coding helps us understand the health of our nation, identify areas of concern, and work towards better healthcare outcomes for all. It is a critical component in the ongoing effort to improve public health and ensure that everyone has access to the care they need. One of the primary benefits of medical coding is increased efficiency in healthcare administration. By standardizing medical information, coding streamlines billing processes, reduces errors, and accelerates reimbursement cycles. This efficiency translates into cost savings for both healthcare providers and insurance companies. Furthermore, medical coding enables accurate data collection and analysis. This data is invaluable for healthcare research, allowing researchers to study disease patterns, treatment outcomes, and healthcare disparities. By analyzing coded data, we can identify areas for improvement in patient care, develop new treatment protocols, and allocate healthcare resources more effectively. The insights derived from medical coding are crucial for advancing medical knowledge and improving the overall quality of healthcare. Despite its importance, medical coding is not without its challenges. The ever-evolving nature of medicine means that codes are constantly being updated and revised. Coders must stay abreast of the latest coding guidelines, which can be a daunting task. The complexity of medical procedures and diagnoses adds another layer of difficulty. Coders often encounter cases with multiple procedures, pre-existing conditions, and complex medical histories. Accurately capturing all of this information and translating it into the correct codes requires a high level of expertise and attention to detail. Furthermore, the pressure to code quickly and efficiently can lead to errors. Inaccurate coding can result in claim denials, delayed reimbursements, and even legal ramifications. Section 5, Case in Point, when codes tell the story. Let's look at a hypothetical scenario. Imagine a bustling emergency room, where every second counts and the medical team is on high alert. A patient arrives at the emergency room complaining of chest pain. The tension is palpable as the medical staff springs into action. The physician suspects a heart attack and orders a battery of tests, including an EKG, blood work, and a chest X-ray. Each test is crucial in determining the patient's condition. The patient is admitted to the hospital for further monitoring and treatment. The medical team works tirelessly to stabilize the patient and provide the best care possible. In this case, the medical coder plays a crucial role in ensuring that the hospital is accurately reimbursed for the services provided. Their work often goes unnoticed but is vital to the healthcare system. They must carefully review the physician's notes, test results, and treatment records to assign the correct codes for the diagnosis, procedures, and length of stay. This meticulous process ensures that every aspect of the patient's care is documented and billed correctly. For instance, there are different codes for a heart attack depending on the severity and location of the blockage. The coder must be precise as these details affect the hospital's reimbursement and the patient's medical record. Similarly, the codes for the EKG, blood work, and chest X-ray will vary depending on the specific tests performed. Each code tells a part of the patient's story, from diagnosis to treatment. The coder must also account for any medications administered, consultations with specialists, and any other services provided during the patient's hospital stay. Their attention to detail ensures that the hospital can continue to provide high-quality care to all patients. Section 6. The human factor, coders on the front line. Medical coders are the unsung heroes of the healthcare system. They work diligently behind the scenes, ensuring that medical information is accurately coded and that healthcare providers receive timely reimbursement for their services. Their work is essential for the smooth functioning of the healthcare system. However, medical coders often face demanding workloads, tight deadlines, and the pressure to maintain a high level of accuracy. The increasing complexity of medical coding and the constant updates to coding guidelines require ongoing education and professional development. Despite these challenges, medical coders play a vital role in ensuring that patients receive the care they need and that healthcare providers have the resources to continue delivering quality care. Section 7. Technology to the rescue, AI and the future of coding. The future of medical coding is intertwined with technological advancements, particularly in artificial intelligence. AI-powered coding software can analyze medical records, identify relevant information, and suggest appropriate codes, greatly reducing the manual workload on human coders. These systems can learn from vast data sets, improving their accuracy and efficiency over time. While AI is not a replacement for human coders, it can significantly enhance their productivity and allow them to focus on more complex cases. AI can also help identify potential coding errors and ensure compliance with coding guidelines, further improving the accuracy and efficiency of the coding process. Section 8. The road ahead, evolving with healthcare. As the healthcare landscape continues to evolve, so too will the field of medical coding. The transition to value-based care models, the increasing use of telehealth, and the rise of personalized medicine will all present new challenges and opportunities for medical coders. Coders will need to adapt to new technologies, coding systems, and healthcare regulations. Continuing education and professional development will be crucial for coders to stay ahead of the curve. The demand for skilled medical coders is expected to remain high, making it a stable and rewarding career path for individuals interested in the intersection of healthcare and information technology. Section 9. Conclusion. The unsung hero of healthcare. Medical coding is often overlooked, yet it is an indispensable part of the American healthcare system. It is the silent language that ensures accurate billing, efficient reimbursement, and valuable data collection. From tracking disease outbreaks to facilitating medical research, medical coding plays a crucial role in improving patient care and advancing the field of medicine. As we navigate the complexities of modern healthcare, the role of medical coders will only become more critical. Their expertise and dedication are essential for ensuring a healthier future for all.